I'm Dr. Suresh Babu, practicing in South Bangalore. I'm practicing for more than 3 decades. Today, I'll discuss about allergic rhinitis. The word rhinitis refers to inflammation of nasal passages. This inflammation can cause a variety of annoying symptoms including sneezing, itching, nasal congestion, running nose, and postnasal drip. A sensation that mucus is draining from the sinuses down the back of the throat. Few episodes of rhinitis are usually caused by respiratory tract infections with viruses and in common cold. Allergic rhinitis is caused by allergies, but it can also result from overuse of certain drugs, some medical conditions, and also some unknown factors. In many people, allergic rhinitis is a lifelong condition that waxes and wanes over time. Fortunately, symptoms can usually be controlled with a combination of environmental measures, medications, and immunotherapy. Who gets allergic rhinitis? Allergic rhinitis affects approximately 20% of people of all ages. The risk of developing allergic rhinitis is much higher in people asthma and eczema, and in people who have a family history of asthma and allergic rhinitis. Allergic rhinitis can begin at any age, although most people first develop symptoms in childhood or young adulthood. The symptoms are often more severe in children and in people in 30s and 40s. However, the severity of the symptoms tend to vary throughout a person's life. Some people go through periods during which they have no symptoms at all. Allergic rhinitis causes. Allergic rhinitis is caused by a nasal reaction to small airborne particles called allergens, which are the substances that provoke an allergic reaction. In some people, these particles also cause reactions in lungs, causing asthma, and in eyes, causing allergic conjunctivitis. The allergic reaction results from activation of two types of inflammatory cells in the body called mast cells and basophils. These cells produce natural chemicals such as histamine, which cause symptoms such as nasal congestion, itching, sneezing, and a runny nose. Seasonal versus perennial allergic rhinitis. Allergic rhinitis can be seasonal, occurring during specific seasons, or perennial, occurring year round. The allergens that most commonly cause seasonal allergic rhinitis include pollens from trees, grasses, and weeds. The allergens that most commonly cause perennial allergic rhinitis are dust mites, cockroaches, animal dander, fungi, and molds. Perennial allergic rhinitis tends to be more difficult to treat. What makes your symptoms worse? Outdoor allergies. The best way to prevent allergic rhinitis is to avoid the things to which you are allergic, because allergic rhinitis is caused by outdoor allergies. This can be hard to do. If you have outdoor allergies, there are some things you can do to help. Keep your doors and windows shut during pollen season. Use an air conditioner to cool your home instead of coolers and fans, which bring outside air inside. And consider pollen counts when planning outdoor activities. It may help to limit your outdoor activities when pollen and mold counts are at the highest. Pollen and mold counts can vary throughout the day. Peak times are grass, afternoon and early morning. Ragweed, early midday. Mold, sometimes peak during warm, dry and windy afternoons. Other types occur at high levels during periods of dampness and rain. Dust mites, if you are allergic to dust mites and live in a humid area. Cover your mattress and box spring in zippered, dust-proof encasings. Wash your pillows, sheets, blankets weekly in hot water at 130 degrees. Dust mites will survive in lukewarm water. Animals' dander, urine, and saliva from feathered or furry animals are major year-round allergies produced by common pets such as cats, dogs, birds, and hamsters, gerbils, and horses. Do not keep any furry or feathered pets in your home. If you must keep the pet, try to keep it outdoors. If the pet comes indoors, make sure it stays out of your bedroom at all times. After exposure to the pet, wash your hands and change your clothes and irritants. Many substances can irritate the nose, throat, or airways. Common irritants include smoke, such as tobacco, smoke from wood burning stoves, are kerosene stoves and fireplaces. Aerosol sprays, strong odors, dust and air pollution. Reducing exposure to irritant can be very helpful. It is also important that no one smokes inside the room or car. Avoid aerosol sprays, perfumes, strong cleaning products and other odor sources in the home. Common signs and symptoms. The symptoms of allergic rhinitis vary from person to person. Although the term rhinitis refers only to the nasal symptoms, many people also have symptoms that affect eyes, throat, and ears. Sleep may be disrupted as well. Symptoms may include the following: nose, watery nasal discharge, blocked nose passages, sneezing, nasal itching, postnasal drip, loss of taste, and facial pain or pressure. Eyes, itchy red eyes, a feeling of grittiness in the eyes, swelling, and dark discoloration of the skin below the eyes, called allergic shyness. Throat and ears, sore throat, hoarse voice, congestion or popping of the ears, itching of throat or ears. Sleep, mouth breathing, frequent awakening, daytime fatigue, trouble doing normal activities, example work. With perennial, which is year-round allergic rhinitis, their predominant symptoms include postnasal drip, postnasal congestion, and trouble sleeping, and persistent nasal congestion is always a major symptom. Allergic rhinitis diagnosis. Your doctor can diagnose allergic rhinitis by doing physical examination, reviewing your symptoms. Medical tests can confirm the diagnosis and identify the offending allergens. Identifying allergens and other triggers. It is often possible to identify the allergens and other triggers that provoke allergic rhinitis by recalling where you were and what you were doing before your symptoms started. For example, spending time outside or with your pets. Noting the time and year during which you have noted the symptoms. Looking closely at the home, work, and school environments for potential allergens. Your doctor may suggest skin prick test if your symptoms are not well controlled with medications, or if it is not clear what is causing your symptom. This involves an allergist putting amounts of different allergens on your skin and observing which causes a reaction. Blood tests are also available, although these are not needed in all situations.